Hello, Dr. Reardon. This is my presentation on schizophrenia spectrum disorders for our PS 101 General Psychology class. The learning objectives we'll be talking about today are describe the signs and symptoms of schizophrenia and related psychotic disorders, describe the most well-replicated cognitive and neurobiological changes associated with schizophrenia, describe the potential risk factors for the development of schizophrenia, describe the controversies associated with clinical high-risk approaches to identifying individuals at risk for the development of schizophrenia, and lastly, describe the treatments that work for some of the symptoms of schizophrenia. Signs and symptoms of schizophrenia and related psychotic disorders. The common or most seen symptoms are delusions, which are false beliefs that are hard to change and often fixed, and they're usually persecutory, where the individual believes that a group or others are trying to harm them. With hallucinations, they are perpetual experiences, even when there are no outside stimulus, and they are usually auditory, visual, olfactory, gustatory, or somatic. There's disorganized speech and behavior, where their answers do not clearly flow from your question, and it's presented through writing or speech. Abnormal motor behavior, where a reduction in responsiveness to an external environment. Amotivation, where a reduction in the drive or ability to take steps or engage in actions necessary to obtain a positive outcome and reduce speech. Other symptoms or effects of schizophrenia are flat affect, which is a reduction in the display of emotions through facial expressions, gestures, speech intonation, and reduced speech, as well as psychopathology, which is an illness or disorders that involves psychological or psychiatric symptoms. The most well-replicated cognitive and neurobiological changes associated with schizophrenia are episodic memory, which is the ability to learn and retrieve new information or episodes in one's life, working memory, which is the ability to maintain information over a short period of time, such as 30 seconds, processing speed, social cognition, which includes problems with the recognition of emotional expressions on the faces of other individuals, problems inferring the intentions of other people, which can lead to symptoms being more negative and disorganized, as well as neuroimaging, which is a set of techniques that uses strong magnets to measure either the structure of the brain, gray matter and white matter, or how the brain functions when a person performs cognitive tasks, working memory or episodic memory, or other types of tasks. The potential risk factors for the development of schizophrenia. There is no schizophrenia gene, and it reflects many different types of genes that contribute something to the likelihood of developing psychosis. The heterogeneous disorder, where two different people with schizophrenia may each have different symptoms, which makes it hard to identify genes associated with the risk of psychosis. Some of the genes potentially associated with schizophrenia are also associated with other mental health conditions, including bipolar disorder, depression, and autism. Some more risk factors are environmental, which can be problems during pregnancy, such as increased stress, infection, malnutrition, diabetes, complications that occur at the time of birth, which cause hypoxia, which is lack of oxygen. Using cannabis increases risk for developing psychosis. Children born to older fathers are also at a somewhat increased risk of developing schizophrenia, and kids who grew up in urban settings. The controversies associated with clinical high-risk approaches. Individuals who are showing milder symptoms of psychosis that have developed recently and who are experiencing some distress or disability associated with these symptoms. When people with these symptoms are followed over time, about 35% of them develop a psychotic disorder. A new category of diagnosis called attenuated psychotic syndrome, and there is some evidence that non-invasive treatments such as omega-3 fatty acids and intensive family intervention may help reduce the development of full-blown psychosis in people who have high-risk symptoms. Treatments that work for some of the symptoms of schizophrenia. Current treatments for psychosis and schizophrenia are the best out there, however, there is a search for more effective ways to help. The first line of treatment is antipsychotic medications, and there are two types, atypical and typical. These are drugs that all share a common feature of being a strong block of the D2 type dopamine receptor, as well as psychological intervention. Cognitive remediation, which has also shown some evidence of helping cognition and function in schizophrenia, In particular, a version of this treatment called CET has been shown to improve cognition, functional outcome, social cognition, and to protect against gray matter loss in young individuals. With the typical medication, although these drugs can help reduce hallucinations, delusions, and disorganized speech, they do little to improve cognitive deficits or negative symptoms and can be associated with distressing motor side effects. With the atypical medication, more mixed mechanisms of action in terms of the receptor types that they influence, though most of them also influence D2 receptors. These newer antipsychotics are not necessarily more helpful for schizophrenia, but have fewer motor side effects. However, many of these atypical antipsychotics are associated with side effects referred to as the metabolic syndrome, which includes weight gain and increased risk for cardiovascular illnesses, type 2 diabetes, and mortality. And these are my